So let's talk about congestive heart failure. We are going to talk about in this video what do you mean by congestive heart failure, the various types of congestive heart failure, the left heart failure, the right heart failure. Then we'll go into the clinical features and how will you differentiate both of them. We'll study the investigations and the treatment. So starting from what do you mean by congestive heart failure, it is defined as when our heart is unable to pump the blood effectively to maintain the fluid and metabolic hemostasis. The causes and the risk factors can be multiple. The list is endless, starting from the coronary heart disease, cardiomyopathies, valvular heart disease, COPD, etc. Now coming to the clinical features. To understand the clinical feature, we must be familiar with the pathophysiology. How does it occurs? The stroke volume reduces. So to maintain the cardiac output, the body tries to increase the heart rate. So there is an increased sympathetic drive. Increase sympathetic drive. The patient presents with palpitations, diaphoresis as the blood is pooling up. So you also find dyspnea, nocturnal cough, PND orthopnea due to the pulmonary edema component. Now coming to the types, the left ventricular and the right ventricular failure. The left ventricular failure is due to the reduced systolic blood pressure, and the right ventricular failure is due to the fluid overload. So in the left ventricular failure, you will find oliguria, you will find pulmonary edema, pleural effusion, whereas in the right ventricular failure, you will find JVP raised, tender hepatomegaly, bilateral pitting edema, and also you will find the Kussmaul sign and the abdominal jugular reflex positive. Now coming to the investigation. On investigation, you will go for the chest X-ray. In chest X-ray, you will find lot of findings which can be remembered with the help of mnemonic A, B, C, D, E. A stands for alveolar edema. B stands for special curly B lines are seen in it, which are perpendicular to the pleural surface. C stands for cardiomegaly. The CT ratio is increased. D stands for dilated prominent pulmonary veins. E stands for pleural effusion. You can also do an BNP levels, which will be raised. This is used to differentiate the cardiogenic cause from the pulmonary causes. You can go for an echocardiography to see this ejection fraction, which is playing an important role in deciding the treatment. Coming to the treatment, it depends whether the ejection fraction is reduced or it's preserved. The preserved causes are like long-standing hypertension, restrictive cardiomyopathy, connective tissue disorders, where the heart has gone under hypertrophy, so less blood come out, less blood goes in. You can remember with this logic. And the second type is heart failure with reduced ejection fraction. These are the acute onset valvular lesions, cardiomyopathies, core pulmonale. These are causes of heart failure with reduced ejection fraction. Now coming to the treatment. The reduced ejection fractions are heart failure are acute condition, so there you can use lot of drugs which can be remembered with the help of mnemonic LMNOP. Lasix you can use to reduce the pulmonary edema component. Morphine can be reduced also to reduce the pulmonary edema. Nitroglycerin, oxygen, and positioning, elevating the head and higher and the leg and lower. And coming to the with the preserved ejection fraction, there we use the ARNI drugs, which includes valsartans and sacubitril. We use the aldosterone antagonist. And if the patient is not responding, then it is termed as medically refractive cardiac failure. There we use the implantation devices. And there is another type also, that heart failure due to the cardiogenic shock. There comes the role of vasopressors. Drugs like norepinephrine are used. And on discharge of the patient of chronic heart failure, we initiate ARNI drugs, which includes valsartans, angiotensin receptors inhibitor, plus sacubitril, which inhibit the breakdown of BNP molecules, which help in reducing the fluid overload. Along with it, we give spironolactone and we discharge the patient. So this was all about congestive heart failure.